So thank you so much, everyone, for joining us here today. Today we are hosting a special guest, Debbie Feierman, who is working out of the Office of Local Engagement at the Centers for Medicare and Medicaid Services. Today she'll be speaking about Medicare open enrollment period and talking a little bit about how to get ready for 2021. So with that being said, I'm going to hand it over to Debbie, who will start her presentation.
Thank you very much, Mackenzie. Hello, everybody. Delighted to be with you here today to talk with you about Medicare open enrollment. Before I get started on the open enrollment, I do want to say that this is intended to be informational, and as always, we encourage you to consult relevant statutes, regulations, and rulings for official Medicare guidance. That having been said, we will advance now to talk about Medicare. And in understanding Medicare open enrollment, I think it would be helpful if we just do a very high-level overview of the different parts of Medicare. So what you see on your slide here now are the two different ways in which people with Medicare can receive their benefits. We have Original Medicare and we have Medicare Advantage. The parts of Medicare are Medicare Part A, which are your inpatient, hospital, skilled nursing, hospice coverage, your Part B, which are your outpatient, doctor visits, specialist visits, preventive health care services, laboratories, durable medical equipment. That's Part B, as in boy. And Part D, which is prescription drug coverage. And in Original Medicare, sometimes referred to as Traditional Medicare, members who have Original Medicare have Parts A and B, and they can elect to join a prescription drug plan. Now with Medicare, there are some costs associated. So there are out-of-pocket costs, and people in Original Medicare may opt to pick up what we call a Medicare supplement or a Medigap plan. And those plans help pay for some of the out-of-pocket costs for people who choose to get their coverage through Original Medicare. Part C is the Medicare Advantage program, sometimes referred to as Medicare Part C. And Medicare Part C includes Parts A, B, and D. So the benefits in Medicare Part A, inpatient, B, your outpatient, and D, your prescription drug coverage, are all together in this one-stop shop with the plan that you choose to get your benefits from. So it may be a plan like an HMO, a health maintenance organization, or a PPO, preferred provider organization, but you are joining a plan where you will get your A, B, and your D benefits, and sometimes you get extra benefits with these plans. They are not Medicare benefits, but some of these Medicare Advantage plans do offer other extra benefits that Original Medicare does not cover. For instance, eyeglasses, dental, silver sneakers. These are some other extra benefits that Medicare Advantage plans can offer. And so people find them appealing because they are able to get some extra benefits. And some of the Medicare Advantage plans can have lower out-of-pocket costs. So when people have Medicare, they can elect to get their benefits through Original Medicare, which is going to any doctor that accepts Medicare and any hospital that is a Medicare provider, or they can elect a Medicare Advantage plan where they get their Medicare benefits. They sometimes can get extra benefits. When you're in a Medicare Advantage plan, there's usually a network of doctors and providers, hospitals that work with that plan, and you would use that network of providers to access your healthcare benefits. So that's just a basic understanding of the Medicare coverages that are available. And so every year, starting October 15th through December 7th, is the Medicare open enrollment period. Next, please. During the Medicare open enrollment period, people with Medicare have the option to join a plan, switch a prescription drug plan, select a Medicare Advantage plan, leave a Medicare Advantage plan they were in that year, and return to original Medicare. There are lots of options. This is the time of the year that we tell folks you need to review the plans that are available, do some comparison shopping, and then make a choice. Make a good choice that fits the coverage that you need, that's affordable to you, so that you can have your benefits, and the coverage that you would select will begin on January 1st, 2021. So you make your choice between October 15th and December 7th for an effective coverage date of January 1st of the following year. And this is a really important time to review and compare both health and drug plan choices. Choose what fits your budget, choose what covers your health care needs. Next, please. Each year, we encourage people with Medicare to do some comparison shopping. Medicare plans can change their costs from year to year. They can also make changes in the coverages, such as their formulary. Sometimes the drugs on their formulary change from year to year. Sometimes the premium costs change. The co-payments can change. So it's very important that during the Medicare open enrollment period, people do their comparison shopping, even if they are very happy with the coverage that they have this year. It's important to review all the plans that are available to make sure that the coverage is the most suitable for you and the most affordable for you in the new coming year ahead. And the way people with Medicare will learn about any changes, they can go onto our website, medicare.gov. There is a comparison tool, a Medicare Plan Finder, and there are a couple of ways to access the Plan Finder to do some comparisons, and I'll touch on that a little bit later. But also, plans are required to notify their consumers, their Medicare beneficiaries, through the annual notice of change that explains the changes from the previous year's coverage. Some people will get these electronically if they've opted to receive it electronically. There's also an explanation of coverage, and that explains the coverage and costs for the following year's coverage. So it's important that people look for their annual notice, sometimes referred to as ANOC, or their explanation of coverage. And they can also review on the Medicare Plan Finder and do a comparison of their plans right there. Next slide, please. When doing your comparison of plans, there are a few important things to consider. Before making any change, you want to look at what is the cost of the plans that you're reviewing. What are their premium costs? What are their deductibles, if they have any? Co-payments with each service, looking and comparing on that. Are there any supplemental coverages? I mentioned in Medicare Advantage, the Medicare Advantage plans can offer supplemental benefits. And so if that is important, you want to look and see what those supplemental coverages are. Do you need prescription drug coverage? If you do, you're going to want to consider what your options are for prescription drug coverage. And you're going to want to make sure that if it's a Medicare Advantage plan or a freestanding prescription drug plan, that drug plan covers the medications that you're taking. You want to look at the doctor and hospital choices that you have with plans and consider the quality of care. We have a star rating system that I'll refer to it in a later slide that speaks to the quality of care from member surveys and other variables. So it's important to consider these things when you are doing your comparison shopping. Next slide, please. I often get asked, how can I research what plans are available and how can I do my comparison shopping? Every year, Medicare beneficiaries do receive the Medicare and You Handbook, and you should have received in the month of October a Medicare and You Handbook for 2021. In the back of that handbook, there's a list of all the plans that are available in the state where the Medicare beneficiary resides, and you can see all the plans that are available there. Their listed costs, their premiums, their deductibles are available there. You also, as I said, should receive an annual notice of any changes from the plan that you're currently enrolled in, and an evidence of coverage document. Another way to do comparison shopping is through some assistance with the State Health Information and Assistance Programs. These are referred to by the acronym SHIP, and every state has one. They are usually, though not always, run out of the State Department of Aging, and you can find out the SHIP in the state that you are in through a couple of different ways. In the back of the Medicare and You Handbook, in the back cover for each state, we list the state that you reside in, your state SHIP phone number. So it should be on the back of the handbook. But if you don't have that, or it's not clear to you, or you are looking for another state, you can go onto our website at medicare.gov/contacts, and you can put in SHIP, and it will pull up, it will ask you what state you want the SHIP number for, and you can click on that, and you will get the contact information for that SHIP. Or you can call our 1-800-Medicare telephone line listed here, 1-800-633-4227. That is a 24-hour, 7-day-a-week phone line. You can ask for assistance, or you can listen for the prompts to get the contact information for the SHIP in the state that you're most interested in. And you can also get that information on the Medicare Plan Finder. So there's a number of ways in which folks can do their comparison, get some information, and also keep in mind these state health information and assistance programs. And I'll probably mention them a little later as well. Next, please. The state health information and assistance programs are, it's a free health insurance counseling program for people with Medicare. It is funded through federal grants to each state. They are run, as I said, typically out of the, or many of them are run out of the Department of Aging, though not all of them. They have a number of trained staff and volunteers who this time of year spend the majority of their time helping Medicare beneficiaries, families of people with Medicare, do this kind of comparison. So they are there to help you, and they ask information that allows them to go through our Medicare Plan Finder with you and review all the plans in your area that cover your drugs, that offer the Medicare benefits, so you can make an informed decision. And as I said, you can find the local SHIP contact on the back of the Medicare and You Handbook. You could also go to SHIP TA, I believe that stands for Technical Assistance Center.org. So SHIP TA Center, all one word, .org, or call 1-800-Medicare to get information about how to contact your state health information and assistance program. This year in 2021, the majority of them are doing virtual or telephone assistance, as is the 1-800 Medicare phone line. They are available to help with a plan search also. And many of them are doing virtual assistance to help you look at your plan choices. Next slide. We do have the 1-800 Medicare, and if you put in your Medicare number, you are able to get a more personalized search. You can also say the word agent at any time if you want to talk to a customer service representative. It is 24 hours, 7 days a week, except on these listed holidays when that help desk is closed. And support is offered in over 250 languages. It would just be important to tell the service representative your preferred language. Next slide. We do have a Medicare plan finder, and in this slide you can see a picture of what it looks like. If you go to Medicare.gov, there is the option to choose a plan, and when you click on the plan, that option, that link to choose a plan, you'll be brought to a page that looks like this, Medicare.gov, find a Medicare plan. And there is a way to log in to do a personalized search that will look specifically based on your medications, your dosage, and frequency. And that would be using your Medicare beneficiary identifier that you can log into either through your My Medicare account or putting it in the plan finder. You can do a personalized search for plans in your area that will cover your healthcare needs, your drugs, your medications. You also have, however, the option to do an anonymous search or a general search if you did not want to log in using your Medicare number. And you can learn a lot there in this plan finder. There's a lot of tutorials. There's a lot of hyperlinks that explain different things to you. So this is the tool that customer service representatives and the SHIPs use to help customers do their comparison shopping. So many of our Medicare beneficiaries throughout the years are getting much more comfortable, and it's been really tweaked and very user-friendly tool as the program has matured and the plan finder has matured. So we encourage people to log in and use this tool to do a search so they can accurately see the most current information that's available to them so they can make their choices. Also, in the plan finder, if a person were to choose original Medicare and had an interest in looking at a Medigap supplement to help with some of their out-of-pocket costs, the plan finder now has available information on those Medigap plans or what we call Medicare supplement plans. So you can also search for those through this tool as well. Next slide. I wanted to mention a little bit about the 5-star special enrollment period. And the reason I do is because Medicare open enrollment period, which we're in now, October 15th through December 7th, is when people are have the ability to make those changes for the coming year. They can leave Medicare Advantage, pick another Medicare Advantage plan with or without drug plan options. They can go back to original Medicare. That is primarily the time of year that all Medicare beneficiaries have this opportunity. Outside of Medicare open enrollment, there are limited opportunities to make plans. You have to have some criteria that would afford you what we call a special enrollment period. And one of the special enrollment periods is the 5-star special enrollment period. And we do rate on the Medicare plan finders. These plans are rated stars 1 to 5, with 5 being the best and 1 having obviously the least amount of stars. And it's based on a number of quality variables, including member satisfaction surveys, and that's how they get their star ratings. So star ratings on the Plan Finder, that you can see them at the overall plan rating, and that's how you would identify a 5-star rating. And so outside of open enrollment period, there is a one-time opportunity, in that year, to switch from the plan that you are currently in to a 5-star. And that would be one of the special enrollment opportunities outside of open enrollment, if you could locate a 5-star plan that you wanted to switch to. And so generally that 5-star special enrollment period is between December 8th and November 30th of the following year. And then coverage takes effect the first day of the month after you've enrolled in that 5-star. So just to know that on that Plan Finder, you will see star ratings going from 1 to 5. Higher stars being the ones that are rated higher on those quality variables. Next slide, please. Conversely, there is a symbol on the Medicare Plan Finder that you see on this slide here. It's an upside down triangle with an exclamation in it. Sort of looks like a cautionary symbol. And it is to caution you that the plan, if it is next to a plan name, this is a low performing star status, meaning that the plan has less than 3 stars for at least 3 consecutive years. So at 2.5 or fewer stars for 3 consecutive years, you would see this icon next to that plan. Members that are in a plan, in a low performing plan, do have a one-time option also to switch to a higher rated plan one time in that calendar year. They don't have to, but they can. And when you're shopping, if you see an icon like this, you should be informed that that is an icon representing a low performing star rating status. Next slide, please. So how do you join a plan during the open enrollment season? You may be able to join the plan, health or drug plan, or if you look at a Medicare Advantage plan, where you get it all in one with that one organization that you select, you can call that plan and tell them that you want to enroll in their plan for the coming year 2021. You can also enroll on the plan's website. So once you do your shopping, there's a link typically to that plan website, or you can go to that plan website and enroll through the plan's website. You can also enroll by calling 1-800-MEDICARE and say the word agent and ask for an agent's assistance in enrolling in a plan for the coming year. There are paper applications. They are available. However, they do take longer to process. So we encourage folks to either call the plan or enroll on the plan's website or get some help through 1-800-MEDICARE. But once you enroll in your new plan, you will be disenrolled from your previous plan. Now, during the open enrollment season, when you enroll in a new plan, you will have that plan for the remainder of this calendar year, and your coverage in the new plan that you select during open enrollment will take effect January 1st of 2021. Next slide, please. Very important cautionary note to people: if you have other coverage from an employer or a union, it's very important that you check with your plan's benefit administrator before making any changes. You could run the risk of losing other coverages for you or any dependents. So many times we hear from people that they've heard from their neighbors that they're in a plan and they have dental or they have a gym benefit and they think they would like that. If you are a person who has other coverage from an employer or a union, very important to check with your benefits administrator before making any changes or choices, because you could risk losing some other coverages. So just cautionary note there. Next slide, please. I mentioned earlier that plans, there are cost sharing that's associated with Medicare program. Typically, Medicare pays an allowable amount for services, and then there's a cost share, either a co-payment or a co-insurance. There can be deductibles. There are premiums that are associated with plans very often, and these can be costly to people, and some people who may have limited income and resources do find it cost prohibitive. I want to, the importance of this slide is to inform people that there are programs called Medicare savings programs that are run in the state department, usually in the state Medicaid agency, that help pay for Medicare premiums or deductibles and or co-payments or co-insurances. And what you see on this slide here are the names of those programs. There are 4 listed here, but as a family of programs, they're called Medicare savings programs. And it is based on income and resources. So the figures that you see here, they do change every year. Both the income and the resources do change. But it's important to know that if you or somebody you know struggles to pay for their medications or pay their Medicare premiums, or having a hard time, or maybe doesn't go to a doctor because the co-insurance or co-payments are costly and have difficulty paying those, it may be worth looking to see if that person qualifies for one of these Medicare savings programs based on their income and resources. And when you work with a SHIP counselor, very often they are assessing that based on the income information that is shared with them by the consumer that they're working with, to see if they do qualify for one of these programs and can get some extra help if they need it. The extra help can, as I said, help pay for the premiums only, or the premiums, the deductibles, and the co-insurance and co-payments. So it can be considerable and save somebody and enable them actually to access services and get the medications that they need. Next slide, please. So I just wanted to share with you, and you can see here where on our website at the Centers for Medicare and Medicaid, you can find our open enrollment resources at cms.gov/Medicare Open Enrollment. We also have a product ordering website that's listed here, where people who work with Medicare beneficiaries can get different publication materials and information like the Medicare and You handbook, and that's available to organizations and consumers. They can order it. It's shipped directly to them. There's no cost for the shipping. There's no cost for the publication. But I just wanted to share the website because it is a great resource for people. Next slide. Some more publications that help people to can walk people through what kinds of choices and what to consider. So, for instance, the publication number 11163, things to think about when you compare Medicare drug coverages. That publication will give you some ideas of when you're doing a comparison of drug plans, what do you need to consider when you're comparing? And it will inform you of the different variables to look at, such as costs and deductibles and premiums and formularies. Is your drug covered on the plan's formularies? So that's a very helpful publication this time of year that we like to share with people, as is the publication, Have You Done Your Yearly Medicare Plan Review, where that publication discusses what people need to do when they are reviewing their health plans, health and drug plans. Next slide, please. So that's Medicare open enrollment period, but I want to tell you that also during this time, one of our other very big campaigns during open enrollment periods, a message that we always share during open enrollment is the importance of folks getting their flu vaccine. And this year, more important is the unique challenges and considerations that come with the public health emergency, the COVID-19. This year, people have been quarantining and not accessing perhaps some of their routine healthcare services. And so we are very concerned, and it's very important to us that people are reminded, please get a flu shot. And we know that there's a hesitancy sometimes to go into a community site. People may be hesitant to go to their doctors. So we want to let you know there are safe ways to go to your physician or to go into a pharmacy to schedule and make arrangements to get a flu vaccine. Very important this year that people think about that, because we already have COVID-19 going on, and we want to make sure that people are vaccinated so that they hopefully don't get the flu, but certainly they are protected and protecting those that they love and are with from any, difficulties during this time. So these are just what some of our flu materials look like. We have a number of social media publications, drop-in articles, and other information that we can share. I think if you go to the next slide, it might have some of that information. Some key messages that we want to make sure that our Medicare beneficiaries know this year is certainly people 65 and older do have a higher risk of some complications with the flu. So it's more important than ever that everybody do their part to sort of cut down the spread of the flu and COVID. And that getting the flu shot does protect you from hopefully getting the flu, but certainly from complications and spreading it to others. And Medicare does cover the cost of your flu shot. You pay nothing out of pocket. So for people with Medicare and for people with Medicaid, there's no cost associated with it. And we want to assure people that there are safe ways to access your flu vaccine this year. Next slide, please. Again, some more materials. We have a variety of tactics that we're using this year because we know people are not going to their normal locations like senior centers or health fairs where they might otherwise access these services. So we have a very robust TV ad media campaign, direct message to people who have their My Medicare accounts. They get a message to their My Medicare account reminding them to get their flu shot. We have social media, Facebook, Twitter, a social media toolkit. We do website updates to Medicare.gov and to CMS.gov. And we also, I think if you go to the next slide, that's some of the tactics here. You'll see that we have some, as I said, some targeted beneficiary direct-to-consumer messaging. And this year, for people who have both Medicare and Medicaid, we have conducted a postcard campaign to people who are what we call dually eligible, meaning they have both Medicare and Medicaid in 10 states specifically, with over about, I think, 400,000 Medicare beneficiaries who receive postcard reminders directly to them, reminding them about flu season and to get their flu shot. So we have a variety of ways in which we are trying to reach people, but certainly we ask our partners and certainly our consumers to share with their friends and family and professional colleagues and constituents the importance of getting a flu shot, make sure people get their flu shot, as well as the open enrollment messages. Next slide, please. These are some more of the tactics that I just mentioned in some of our websites, Medicare.gov. We do have drop-in articles. We have blogs. So if any of you have access to an online newsletter, or you do a blog, or you can use the social media toolkit, we would encourage you and certainly ask you to share the message with those that you reach. Next slide. Again, here are some links to some CDC resources where information can be shared, flyers, posters, widgets. There's multi-language fact sheets available both on the CMS website as well as the CDC website. So there are several other languages that resources are available in. Next slide. And before I close today, I just want to share with you CMS Office of Minority Health has a wonderful health literacy material called Coverage to Care. And you see the link here where you can access the Coverage to Care materials. We have, it is really health literacy for anybody, not just people on Medicare and Medicaid. We use this, we take this and share this with anyone we really speak to about understanding some of the language of healthcare. So what is a co-payment? What is co-insurance? What's the difference between them? What's a deductible? And we have a roadmap, and we have a brochure, we have flyers and posters. These are available at our CMS product ordering website listed here. And again, they are free of charge to organizations, and individuals can be shipped right to you. But I put the link here because I think it's really worthwhile to see what materials may help you as an individual or the clients that you serve, the consumers that you work with, in helping them understand their health care coverage so that they can most appropriately utilize it and be an active consumer in their care. So with that, I will close and thank you for spending some time learning about the Medicare open enrollment period and some of our other opportunities.
Thank you so much, Debbie, for providing this critical information surrounding Medicare open enrollment period and helping us all to get ready for 2021. We did record this webinar, and it will be posted on our website for anybody who is unable to join us today. And if you do have any questions, please do reach out to us at our website, namimaryland.org, namimd.org. As well as our office, you can give us a call at 410-884-8691. We wish you all a safe and healthy week, and please don't hesitate to reach out